This is a case of alveoloplasty post extraction, full mouth post extraction case. So for further rehabilitation of edentulous jaws, so we need to go for complete extraction and planning for either complete dentures or implant based dentures or hybrid dentures. So before that we have to see any spicules in the jaw. So you can, with the index finger, you can palpate it, complete jaw from posterior to anterior, both the jaws, edentulous jaws. So any complaint from patient side, sharp spicules with the painful ulcers clinically at the same time. So being an operator, surgeon, you have to palpate each jaw, every surface, check the sharp spicules. If any sharp spicules are found, it's better to go for surgical excision before planning for your primary impressions and further complete denture planning. So before starting your excision of the spicules, bony prominences, plan your incision design. So that is on the crest of the ridge, then two relieving incisions both the side. Okay, so after that you have to reflect the flap. Okay, then try to expose the, so once you design the incision for the flap raise, so try to reflect the flap subperiosteally, so that so you can expose complete bony prominences. Okay, and it should not be a supraperiosteal reflection, it should be a subperiosteal reflection. So once you do that, you can see here exposure of the bony spicules. So here you can see complete exposure of the bony spicules. Okay. Once the bony spicules are exposed, so either you can use a bone ronger to remove excess spicules or bony part, or you can use a what is called a trimmer. So better to always use a bone ronger, so that we can avoid what is called more resorption of the bone. So if you use trimmers like micromotor trimmers, it will produce heat. So because of that, there will be more resorption of the ridges will be seen post what is called removal of these kind of spicules. So better to go for the rongers. If at all requires finishing, this thing can use a bone trimmers. So just try to remove the excess bony spicules. Once bony spicules are removed, you can use a bone file. Try to smoothen the sharp borders. Then go for the suturing. So once you do alveolectomy or alveoloplasty, so you have to close the wound with the silk material, so that it will heal satisfactorily. See that there should not be any oozing. So anything is there, you have to arrest it or reopen the flap and arrest the bony blade and again close it. So you can remove the suture after 7 to 8 days. Then further you can plan for the rehabilitation.